Bone Break with Dr. Clayton Lane.
Approximately 1/2 of recreational tennis players will suffer from tennis elbow at some point during their training. The risk increases with age and number of hours played per week. All of the muscles that extend the wrists and fingers originate from a single bony prominence called the lateral epicondyle. While the medical term lateral epicondylitis implies that it is an inflammation of the bone, it is actually a breakdown of the tendon that attaches to the epicondyle called the extensor carpi radialis brevis. This micro-tearing is associated with repetitive extension of the wrist, which is not exclusive to tennis. Pain when grasping objects or extending the wrist are common complaints. Rest, ice, and anti-inflammatories are the initial treatment. This is followed by stretching, strengthening, and other modalities in physical therapy. A counterforce strap works by redirecting the muscle tension away from the lateral epicondyle and can be helpful when rest is not possible. Injections are sometimes used in severe cases, and surgery is required rarely after 6 months of failed non-operative treatment.